Terming centre's vaccination policy as arbitrary and irrational, the Supreme Court has questioned that when healthcare workers, frontline workers and people above 45 years of age are being vaccinated for free, why are individuals between the ages of 18 and 45 being made to pay to get immunized? Ruling that vaccination is absolutely essential and should be the topmost priority for all governments, the Apex Court asked the centre to provide full data on vaccines ordered and procured till now. The top court has asked the centre to explain how the amount of rupees 35,000 crores earmarked to buy vaccines in the union budget has been spent so far and whether the money can be used to vaccinate the entire country for free. Centre will have to file the full data on the purchase history of the three vaccines, Covishield, Covaxin and Sputnik V till date, along with details of dates, quantity of vaccines being ordered and their projected date of supply. In light of Centre's claim before the Apex Court that the entire eligible population will be vaccinated by this year's end, the court sought information on the exact number of people already vaccinated with either the first dose or both doses of COVID vaccines in both urban as well as rural areas. The court will also delve into Centre's deliberations which culminated into the current vaccination policy, as Centre will have to submit copies of all documents and file notings reflecting its thinking on the vaccination policy. While Centre had submitted before the top court that all states have decided to vaccinate everyone for free, the court has asked all the state governments to either confirm or deny this submission by a written affidavit. The court held that if states assure through an affidavit that they are vaccinating for free, the population within their territories can be assured of their right to be vaccinated for free at a state vaccination centre. In view of rising incidents of post-COVID mucormycosis, the court sought details of the steps taken by the union government to ensure drug availability. The court will hear the case after 2 weeks and will decide on the further course of action based on the replies filed. 2 days back, the top court had asked the centre to file a copy of its policy document on vaccine procurement and pricing and also consider amending the vaccination policy to make it more inclusive for rural areas. The court had held that India is a union of states and centre needs to procure vaccines for the entire country. The court had warned the centre to not file a mere affidavit saying that the situation is dynamic, though it refrained from passing any orders or entering the realm of policy making to hamper vaccine negotiations or India's welfare. Centre had assured the Supreme Court that it was confident of vaccinating all Indians above 18 years of age by December 2021 based on expected vaccine production data given by 3 Indian vaccine manufacturers, namely Serum Institute of India, Bharat Biotech and Dr. Reddy's Laboratories. Appearing for the centre, Solicitor General Tushar Mehta had argued that the Indian government is already in talks with foreign vaccine manufacturers like Pfizer and others and may be able to vaccinate all eligible Indians even before December if imported vaccines start getting administered in the country.